Hi, welcome to All Things Home Care with Dana Arnone. I am a registered nurse with a focus on home health care for more than 30 years. Each week, we tackle topics and issues specific to seniors and the homebound. This week, we'll be discussing fair pay for home care and its fight to be included in the governor's upcoming budget. Today, my guests are Mildred Gallery, who is the Long Island organizer for the Caring Majority, and Alana Berger, campaign manager for Hand in Hand. And, as always, I'll be answering your most frequently asked questions. So I thank you so much, Alana, for being here with us and talking about this subject, because I know that, you and I have these conversations all the time, but I don't know that really the people in the, out in the public really understand how important this Fair Pay Act is really. So why don't we talk about a little bit about you and just introduce yourself to the people.
My name's Alana Berger. I work for an organization called Hand in Hand and help coordinate the New York Caring Majority Coalition, which is organizations across the state representing older adults, disabled people, home care workers, home care agencies, and family caregivers, working to make sure everybody who needs home care can access it, and people who do that work are paid a living wage for the important work they do. I care about this issue for many reasons. One is that my grandmother, who was my only grandparent my whole life and was, what an amazing grandmother. She passed away in April 2020 at 108 years old. And the last 4 years of her life were incredibly high quality. She had a stroke at 104 and was able to return to her own apartment to be around her friends and her community because she had home care workers who kept her going 24 hours and who made her life possible. So I care very deeply about this issue because I believe everyone should get that kind of care, and the folks who do that care should be paid so much more than they're currently paid.
So I think everybody that is a big advocate, like myself, I always say that I do this for my father, who's 93. I know Mildred has a lot of people that she has cared for in her life. And I know that just being in the business that I'm in, when people call it, they don't really realize or understand what goes on as far as what the aides are getting paid and what that really means, what the work of a home care worker actually entails. From getting to the patient, from dealing with different personalities in home, to actually physically caring for someone, whether it's bathing, dressing, toileting, diapering, and then to return back to their home on public transportation, sometimes taking several hours and several buses. So that's something that I think that people should realize, that the pay should equal the work. And right now, it doesn't even come close.
A lot of times we talk about the caregiver, and it seems like people don't want to notice that or recognize that. So if we talk about the family and how they're suffering in this also, even in the presence of a home care worker, there's still suffrage because the home care worker isn't acknowledged by pay. If you are not paid a living wage and you are the working poor, what is going to keep you? How can you continue to do this job? We just can't afford to stay in this job, in this career. We want to. We don't want to go anywhere. We love caring for people, which is why we do that.
What we've got from PHI is that the average annual earning of a home care worker in New York State is $22,000 a year. Anyone just take a minute and think about what it means to try to raise a family or just survive on $22,000 a year, and then factor in the kind of work that is being done to earn that ridiculously low wage. We're talking primarily about Medicaid funded home care. Obviously, in private pay, there are individuals who have the option, if they have the budget, to pay more. But for many people who receive Medicaid and get home care through Medicaid, which is a huge percentage of the home care in the state, it's minimum wage. And so in New York City and now Long Island and Westchester County, as of January 1st, it's $15 an hour. In the 54 counties north and west of Westchester, until December 31st of last year, it was $12.50 an hour, and now it's up to $13.20 an hour. Just noting that the fast food minimum wage went up to $15 statewide last July. So in many counties of the state right now, home care workers are paid less than fast food workers.
No,
The ask is more
Yeah.
of a home care worker, but the pay is less. And that's always my argument with people that say, so let them be a fast food worker. Well, if they're a fast food worker, then what are we going to do? Like I
No,
always
then your family member or your loved one potentially goes without care.
Yeah.
We're talking about a human life over food.
Well, I think that's why these conversations are so important, because we're bringing awareness to the topic. Where half the time I'm talking to my patients, the families of the patients that we care for, and when I'm saying things to them, it's like a light bulb goes off. So unless I sit there and have intimate conversations one-on-one with a bunch of people to make them understand, they really don't understand.
But it's
That's
good,
why this
but when they
conversation-
do, they're willing to support
Yes.
the issue because they realize how unfair and unjust it really is.
Yeah. What is the ask for the government for the workers?
Yeah, and I want to just say, I so agree with this whole line of conversation. I think so much like family members who are struggling to find care for their loved ones because they can't find workers because there's a workforce shortage. New York has the worst home care workforce shortage in the country. The thing you said about kitchen tables, like we do all talk about this. These are very personal, intimate issues. But the reality is and then we tend to blame ourselves if we can't find the adequate care for our loved ones. But the reality is this is not an individual problem. It's a societal problem that we don't invest in this work and in care. So our ask, we have legislation called Fair Pay for Home Care. And what it would do, it would acknowledge a lot of what we're talking about. It says home care should not be a minimum wage job. So the legislation says home care across the state, the minimum wage for home care should be 150% of the highest area minimum wage, which would mean right now statewide, it would go to $22.50 an hour. There's so many people who want to do home care. And it takes a particular kind of person, right? Someone who's willing to put in that work, who appreciates, and Mildred's a great example of this, who wants to work with people. And it's a real shame that people who want to do that work, even though it's so hard, can't because they can't pay their bills. So this would help us. We have a study from CUNY that says if you got fair pay for home care in New York State's budget, raise pay for home care workers, you would eliminate the home care workforce shortage in 5 years. You'd create hundreds of thousands of jobs, and you could bring in close to $5 billion back into our economy by increased spending in neighborhoods, because home care workers, when they get more money, that goes back into local economies. And also savings, because 57% of home care workers right now in New York State have to rely on public benefits themselves because the pay is so low. So we would save money because workers would not have to rely on public benefits.
Hold that thought, Alana. We have to take a quick break. When we return, we'll continue our conversation. Hi, welcome back to All Things Home Care with Dana Arnone. We're discussing the need for fair pay for home health care workers. So I think, Alana, the logical question is then why is this a fight? Like what's the fight about? It sounds very logical. It sounds like it's a no-brainer. It's a cost savings to the state of New York. You can't service patients if you have no workers. So it's kind of like, it's not only a workforce issue for the workers, but it's agencies will close, people will be institutionalized.
Families will have to take leaves from
Leaves
work,
of-
if
yes,
not
it's
leave
true,
their
yeah,
jobs.
yeah.
So it actually does affect everyone.
Yeah.
It has that talk about a trickle-down effect.
So that's what I'm sure people are going to be watching this and saying, well, then why no? Like, why is it such a battle?
I mean, that is the sad question that everyone in some way in this conversation has referred to, the sort of sad state of where our society is. At the end of the day, state budgets, federal budgets are documents that reflect the values of the moment we're in. And it has seemed, and I can say particularly with Governor Cuomo over the last many years, it was the work that women did, that caregivers did, was not valued by our state. And so part of our work in organizing that what New York Caring Majority is doing is to say, one, our budget should reflect our values and should show that we care about our loved ones, we care about older adults and disabled people, we care about home care workers. Financially, you get a better return on investment when you invest in the care workforce than you do in giving money away to billionaires. And so those are the arguments we make. And the way we are trying to get those across in this year's budget is because home care is such a universal issue, right? All of us, there's a great quote by Rosalind Carter that says there's 4 kinds of people: people who give care, people who receive care, people who will need to give care, and people who will need care. All of us are impacted by this issue. So we are working to make sure that our governor and our legislature understand that. And I'd say we're making great progress because right now we have bipartisan support for fair pay, both in the Assembly and the Senate. So it's not a Democratic issue. It's not a Republican issue. It's not a suburban or rural or urban issue. It is a universal issue across New York State.
This includes the developmentally disabled and the people that provide services for the developmentally disabled as well?
Well, it's a little confusing because this specifically fair pay for home care refers to the Department of Health funded Medicaid. So it is largely PCAs, so PCAs, HHAs, and then personal assistance in the consumer directed program. It does not apply to DSPs, so direct service professionals, although many home health aides and PCAs and PAs do care for folks and support people with intellectual disabilities as well as physical disabilities, but it is separate than DSPs who work under the Office for Mental Health.
But the struggles and the fight is the same, you know, like, because I know that they have the same issues going on within the group homes and within their own, the families' homes and things like that. So, I mean, the fight is the same. And I know that you have the backing of 1199 Union, because I know that the union is fighting for this as well. They want their workers all to have the fair pay. So is that something that, if there's people out there that want to join the fight and then they want to engage the conversation, what do you suggest that they do?
There's many, many ways to get involved. If you want to find us, you can find us on Facebook at New York Caring Majority or on Twitter at NY Caring Majority. We have a website, www.nycaringmajority.org, and you can sign up to get on our list there. We have Republicans and Democrats. We have the union. We have AARP is on board. We have the New York Association on Aging, which represents every county office for aging across the state. We're really building support across many organizations. We're launching a Faith for Fair Pay initiative in the next few weeks. But yeah, the best way to join is check out the website, Twitter, or Facebook, and then plug into the many actions we have coming up.
Or simply call your local legislators and
Yes.
say that you support fair pay.
Yes, absolutely. We need everyone meeting with their local legislators to make sure that they're supporting fair pay for home care. The Assembly bill number is A06329A, and in the Senate, it's S05374A. Or just, you can Google, if you go to the Assembly, New York State Assembly or Senate website, Google fair pay for home care, and you'll see the list of all the legislative sponsors. And so you can see if yours is on there. And if not, you can give them a call to meet with them. And if they are on, you can give them a call to meet with them to thank them and ask them to continue support through the budget negotiation process.
So for caregivers, for patients, for family members, this is when you can help yourselves. This is when you can do your part for yourself, for your family members, by making a call in support of fair pay. That's just a little thing you can do that can make such a big impact. Your voice is powerful. It's you that needs to speak up. The power is in the people. Don't forget that. And I think in society we have forgotten that. Who are really the important ones? The decision makers. It's we, the people.
When does the budget get decided now?
That was what I was going to say. I didn't mention that. So it's only a couple months. The budget is done at the end of March. So we have the next few weeks to get in, hopefully, both the budgets that the Assembly and Senate put out, and then keep the pressure up so that when the Senate and Assembly is negotiating with the governor, that we get fair pay in the final New York State budget, which should be signed by April 1st.
Very good. Okay, well, we're all praying and we're all here to support you.
Thank you.
And we're looking forward to a celebration, right? Come April.
Yes. And thank you for all you do as well.
We'll be right back. Hi, welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. Finding the right home care agency is one of the most important decisions that you'll make for you or your loved one. Before you make that decision, consider interviewing multiple agencies. Interviews are one of the best ways to get to know who you're hiring. You'll want a caregiver that is transparent, educated, licensed, skilled, and caring. To help make an informed decision, consider asking the following questions as it relates to compliance. This is an evolving and ongoing process that helps prevent fraud, waste, and abuse. Compliance with the state, federal, and accreditation guidelines, rules, and regulations is imperative. Here are a few of the questions on compliance to consider. Ask if they're licensed by Department of Health. That would imply that they follow the rules and regulations that the Department of Health has set forth, meaning they're audited every 3 years, they are compliant with their HR department, they're compliant with their payroll and billing, and they're compliant with the coordination services. Are your caregivers bonded and insured through your agency? That's actually a very good question. If the agency is licensed through Department of Health, you should feel confident and secure that those workers that are entering into your home are covered by the agency's insurances, including liability, disability, and workers' comp. What are your privacy practices? Most agencies that are licensed through Department of Health, or just as a standard of practice, would follow HIPAA rules and regulations, which would mean that we do not disclose personal or private or health information about our clients or the aides. If you have specific questions as far as privacy practices, most agencies will leave you that HIPAA rule and regulation in your home upon the start of care that the nurse goes over with the families. So yes, you'll get a copy of them, and you'll be able to refer back to those privacy practices at any time. Well, these are all the questions that we have for today. Please send me any questions that you may have at info@allthingshomecare.org. Hi, welcome back to All Things Home Care with Dana Arnone. We're discussing the need for fair pay for home health care workers. Let's take a look at two public service announcements. One was created by the New York Caring Majority, and it tells the story of Loretta, a patient receiving in-home services. And our second PSA is the story of Enid, who commutes more than 2.5 hours each way every day to care for her patient.
Sometimes I feel angry. You know, I worked all my life and now I can't even get help. That bothers me. I've worked since I was 13 years old. I'm 81 now. I can't do what I used to do, you know. I have fell a number of times and hurt myself. So I'm not supposed to be in a tub without somebody being in there. So I need the aid for that. When I start cooking, I go sit down, and a lot of times I just fall asleep. I never thought I'd be in this condition, but I'm here. And I have a big family, but they all work. They all got their families. They can't help me. All the agencies saying they're short. I supposed to have 5 days. I've had 1 day, I've had 2 days, but no more than that for a long time. Living by yourself, it's lonely. And so just having that face of somebody to talk to and laugh, it makes a difference. A lot of seniors don't have anybody. Most of your home care people are women. And there are also many of them are women with children, you know, and they gotta eat. But these women are working and sweating and lifting. So at least give them a good salary to come in and be able to go through all of that. And if you give somebody a good salary, they'll come to work.
We will not go back to normal. We will not go back to normal.
Home care workers help me so much, and I want to help them by being here today.
And taking out your pots and pans is one thing, but the best way to demonstrate our love and commitment to all that you do is to show you some money and address income inequality and the feminization of poverty with the stroke of a pen.
Today in Union Square, advocates rallied for home care workers, who on average make about $12.50 an hour. In New York, 91% are female, 77% people of color, and 57% of them are on some kind of public assistance. For people like Loretta Copeland, the proposal is a no-brainer.
I want a normal life. I want to be able to enjoy what time I have left.
So I start my day this morning from 7:45. I have to take 3 buses. This is bus number 2. Waiting on the 3rd bus, and I have to pay again. We started from 7:45, and now it's 20 minutes after 9. I'm still not at work as yet. Ellie, 3rd bus is here. If the 2nd bus is late and I miss the 3rd bus, I just take a Uber to work that I can get to my patient on time. Because sometimes they know, my patient know what time I get there, and if she don't see me, then she start to worry. But once I get to work, it's a blessing.
If Enid can't be here, I was a teacher, I can't leave the classroom to come and be here. It's disruptive to my mother's safety because my mother is mobile. I can tell her don't get out of bed and don't do things, but that doesn't mean she's going to do that. She's got a bad heart, and sometimes just getting up makes her dizzy. She's passed out before, so it's important that she be able to get here and be here on time. Think of the day that she puts in. If she's leaving at 7:30 in the morning, what time does she get up? Her day right now is 6.5 hours, 5 days a week. Add on 2.5 hours of travel to that on each end. How does that affect the person who takes care of my mother?
It's worse in Long Island. Some of the cases, there's no bus, so you have to take the Long Island Railroad, and you have to walk 15, 20 minutes to get to the patient house. We don't get enough pay to take the Long Island Railroad because it's expensive.
Every day that she's here, my mother's life and my mother's safety is in her hands. She's taking care of a person who's got all 4 heart valves leak. She's got a weakened chamber in her heart. She's got a thickened chamber in her heart. She's got mild dementia. She's got arthritis. She's mobile. Enid keeps her mobile. Enid makes sure that in spite of the fact that she does not want to do it, she does her physical therapy every single day. It means everything. It means everything. That she be able to shorten her day. You're talking about 22 minutes each way. So 45 minutes rounded off as opposed to 5 hours. I feel this has become such an elitist issue that people don't understand that maybe because some of these health aides don't have a college degree, they may not have originated their life in this country, they may speak with an accent, but I feel like they don't value the job that Enid does and that health aides do. She takes care of my mother's personal cleanliness. I mean, things that other people wouldn't even want to do necessarily for their own loved ones. She cares for her like she would her mother. While they may not be important to you right now, they're important to millions of people across this country. And they are very valuable. They do incredible work for very little pay and for very little gratitude.
It was nice meeting you, but I have to go now to catch my bus. So you have a good evening.
Well, that's all the time we have for this week. To learn more about how we are helping improve the home healthcare industry, or you want to see any of our previous shows, please visit us at allthingshomecare.org. Also, please follow us on Facebook, Instagram, and like and subscribe to our YouTube channel. And please always remember that there's no one more essential than those who come to care for us in our homes. See you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.